Hi, good afternoon, everyone, and welcome. I'm Maya Sisla, Deputy Director of the Aspen Tech Policy Hub. For those of you who are new to us, the Aspen Tech Policy Hub is a policy incubator that trains technologists in the policy process through fellowship and executive education programs. I'm thrilled to welcome you all today to our second demonstration day event of the second cohort of the Tech Executive Leadership Initiative, also known as TELI. The TELI program is a joint initiative of the Aspen Tech Policy Hub and the Tech Talent Project. It is a 10-week skills building initiative to prepare experienced tech leaders to engage effectively with public sector challenges. The program provides senior tech professionals with a unique leadership opportunity to build skills through real-world engagement with government and policy. The Hub and Tech Talent Project came together this spring to run the second cohort of this initiative. Every week from January to mid-April, we met with our cohort of tele leaders to prepare them for government and policy work. This afternoon, we'll be introducing a few of those leaders. They will be presenting results from the culminating project of the TELI program. Throughout the TELI program, we asked the leaders to participate in a variety of exercises, from writing policy memos to creating stakeholder maps to working on a 6-week challenge project. Their culminating project asked them to take all of the lessons learned and devise a solution to a real tech policy problem that governments are now facing. Last week, we presented our first set of projects focused on improving technology project approval processes at the state of California. This week, we'll be presenting our second set of projects on a problem that many state governments are grappling with, the idea of COVID-19 digital credentials. As more people across the country receive COVID-19 vaccines, there is a growing interest from businesses, schools, and other entities in a mechanism to confirm individuals' vaccination status before they access areas and certain services. Various groups have proposed a variety of solutions, from digital versions of the physical CDC vaccine cards many of us received to government-issued health passports. As you might imagine, state-managed digital vaccine credential systems bring up a myriad of privacy, security, and ethical questions. Our leaders were tasked with the following question: should states create digital vaccine credentials given the widespread implications of doing so? They were asked to give a recommendation to the fictional state of Outdoorsville on whether the state should implement digital vaccine credentials, and if not, what the state should do to ensure that businesses and schools can open up safely. The leaders were split into 3 teams for this project, and as such, we'll have 3 teams presenting their own unique solutions. To be clear, these teams only had a few weeks to both understand their problem and propose a solution to this very tricky and complicated issue that was changing in real time. As you'll see, they've come up with outstanding work in this limited time, which just goes to show the power that this type of creative thinking can have to improve policy and government services. Some brief logistical announcements for this afternoon. After all of the teams present, we will introduce our fabulous keynote speaker, Cyd Harrell, a Civic technologist and former Chief of Staff of 18F. We also wanted to know that the teams are releasing their projects live, so please check out the links in the chat box so you can follow in real time. Last, we'll save a few minutes for Q&A at the end. Please submit your questions in the Q&A box below, and we'll have the team members either answer their questions live or via the chat box. So with that, I'm thrilled to introduce the 4 tele leaders on the first team for this afternoon. This first team includes Elizabeth Nash, a data executive who is currently Chief Data Officer at PolicyMap, a platform that solves place-based problems for government agencies. Laden Nassarian, a data engineering project manager at Apple focused on data privacy and machine learning. Brian Sager, a tech founder of multiple companies who is currently founder and CTO of Reveal Networks, a natural language processing company. And Tony Sebro, an attorney engaged in tech, intellectual property, and privacy issues who is currently Deputy General Counsel at Wikimedia. For this presentation, we'll have Elizabeth Nash and Tony Sebro presenting. Over to you, Elizabeth and Tony.
Thank you, Mai.
Elizabeth, just so you know, you're on mute.
Thank you. Age-old problem these days. So thank you very much for the opportunity to present our recommendations on this really tough question that's on many of our minds. Our group had a solution that I want to talk a little bit about today. And that is that we think that instead of building out a centralized or decentralized digital vaccine credential system, the state should advocate for the federal government to issue guidance on the issue. We think this because with this approach, we can ensure consistency across state borders to account for tourists and workers coming from outside the state. We think that they could be used in a private or public credential. We believe that it's a neutral stance on a highly divisive issue. This solution could ensure privacy, data protection, and transparency. And as such, we think that Outdoorsville could submit a memo to the Department of Health and Human Services in support of a credential standard that could be adopted by either the public or the private sector. We also think that they could advocate for a nationwide set of clear technical and ethical standards that would serve Outdoorsville citizens and the United States citizens more broadly. Let's talk a little bit about the context in which we're working. I think we can all agree that the context changes daily on this issue. Given the uncertainty around so much related to vaccines and the vaccine passports, we have to consider that herd immunity is not a certainty due to vaccine hesitancy, and the lifespan of the virus is undetermined at this point, perhaps making the case for a more assertive advocacy for a federal government-guided vaccine credential. Virus variants are proving to be wildcards. As one epidemiologist at Johns Hopkins that we interviewed noted, the variants are moving the goalposts for herd immunity. Again, these recent developments and our findings about herd immunity and whether or not we'll even get there indicate that a vaccine credential may be more necessary than we had previously thought at the beginning of this project. There are multiple emerging vaccine technologies that are being developed all over the world. These vaccines have differing efficacies, and they also may have differing durabilities. Travelers to the state of Outdoorsville could come from any of those locations. Building a credential system of dubious value is potentially expensive. Private industry is already working on a vaccine credential. Our recommendations are practicable by private industry or through public implementation. Numerous jurisdictions, states, and several federal agencies are initiating vaccine credentials as well, but the standards have not yet been established, and that's where we come in. Potential use cases could differ by country, state, county, city, and local businesses also, with different tolerances for assumed risk for specific constituencies. And finally, there's little proof that a vaccine credential system will actually reduce the risk of COVID-19 transmission in Outdoorsville. So the first item that we are recommending is a memo to the Department of Health and Human Services to advocate for a federal credential standard. Federal guidance would mean that states adopt similar protocols and can enjoy consistency across state borders. The specific technical and ethical and equity requirements that we're suggesting that could be issued by the Department of Health and Human Services would mean that any system would be grounded in best practices. I'm now going to turn it over to my colleague, Tony.
Thanks, Elizabeth. I'll first walk you through the technical criteria that we think Outdoorsville should advocate to be included in the credential standard. As a threshold matter, we recommend setting the standard for immunity to be such that credential holders have been inoculated with vaccines that both protect the individual from the virus and prevent the spread of COVID to others. Next slide. Now on to the technical requirements. We recommend that Outdoorsville strongly advocate for a standard that promotes interoperability across different credential systems. This is especially important to Outdoorsville given the state's economic interest in leisure and business travel. We recommend that the credential be built around a web-based technical standard that allows for the use of readily available software stacks. Any such system should also comply with FDA guidelines around electronic records, as well as HIPAA. We also recommend that these standards comply with and are interoperable with international standards to facilitate international travel. And lastly, as table stakes, any associated mobile apps should be made available on both Android and iOS. Next slide. We also think that the standard should be future looking, and so therefore include guidelines regarding metadata related to an individual's vaccinations that we think might be useful in the future. To the extent that any such system is built around an immunization information system on the back end, that system should maintain metadata around when the user was vaccinated in case this information becomes useful and actionable as we learn more about COVID, about vaccine efficacy, and about the mutation of new strains. This would also mean that the system should be able to distinguish between different types of vaccines, including their relative efficacy against emerging variants. Next slide. We also think that the system should adhere to best practices regarding security. At a minimum, the system should support the transport layer security protocol. Any personal data that needs to be collected should be secured securely and encrypted on both the device and in transit. The standard should call for a clear data access framework to be adopted that only grants the minimum amount of access needed to complete a particular function. Also, we want to make sure that credential holders clearly understand the conditions of their use of the credential. So transparency is a must. Next slide. I'm going to shift to ethical requirements. For starters, data collection should be opt-in, with users maintaining control over their personal data. This would also mean that if they want to leave the system, they should be able to delete their data from the immunization information system. This nature of opt-in should apply to commercial entities as well. Next slide. We acknowledge that access and adoption may still be adversely impacted by existing societal inequalities. The federal standard should avoid applications that might inadvertently widen that gap. So in other words, the system should not be used to restrict access to essential services. It should only be implemented in jurisdictions where the vaccine is available to everyone. And we're getting very close to achieving that already. The solution should be affordable for individuals and governments to implement. In general, you want to avoid discrimination and exacerbating existing inequalities such as vaccine hesitancy in certain groups or adversely impacting pregnant women or other groups that aren't able to gain access to the system currently. Next slide. Very briefly, offline functionality, the system should be portable to allow for non-mobile users to provide either paper copies or some other flexible format. You can't require someone to have an iPhone and a data plan just to buy groceries. Next slide. The standard should encourage implementations that adhere to data minimization principles. So only collect the minimum amount of data and store it for the minimum amount of time to maintain efficacy. There's no need to track unnecessary data or use third-party tracking or dependencies. And lastly, the federal standard should require state-level implementation of a digital immunity credential to be built using open source. This should apply to both the application and on the server end. And we included this as an ethical issue because using open source will promote transparency and engender trust. It also prevents vendor lock-in. And lastly, we would benefit from crowdsourcing the identification and fixing of vulnerabilities and adding improvements. And next slide. That is it. On behalf of our group, it's been a privilege to participate in the Tele program. Thank you to the coordinators for your feedback and guidance and support. I'll hand it back over to Mai, who will introduce the next group.
Thanks so much, Elizabeth, Tony, and to the rest of your team for your work on advocating for federal standards for vaccine credentials. To the audience members, I also want to remind you that if you have any questions for our leaders, please put them in the Q&A box at the bottom of the screen, and we'll get to questions for all of the teams at the end of this webinar. And if you also look at the chat, you'll see a link to the first team's products. Next, I'm thrilled to introduce the next 5 Tele leaders on the second team for this afternoon. This second team includes Jason Botts, a fractional executive to multiple tech companies and a board member to the North Carolina Department of Commerce, Cecilia Merihart, Director of Business Architecture at Splunk, Rebecca Gasser, the CIO and VP of IT at Ferrandino & Son, where she works to modernize the company's tech landscape, Enrique Jenkins, an IT leader focused on strategy and execution and current head of IT at DoorDash, and Jean Yoon, a tech product leader, startup exec, venture capitalist, lawyer, and now candidate for the California State Senate. For this presentation, we'll have Enrique Jenkins and Cecilia Merihart presenting. Over to you, Enrique and Cecilia.
Good afternoon, everyone, and thank you for the opportunity to share our proposal today. I am Cecilia Marhart. I'll present our plan, and then Enrique will share a demo at the end. So next slide, please. Every state in the nation, as we know, has been working to navigate this ever-changing environment and the guidance related to COVID-19. So when we were considering how to advise the state, we looked at a variety of options from across the spectrum, from do nothing to do everything and build their own standalone solution, to even something in between. Next slide, please. Since the state already has a reputation as a leader in creating and deploying technology in service to its citizens, we believe that the correct solution would be for the state to take a more middle of the road approach and create an open framework to respond to the current needs and lay the foundation for future needs. Therefore, next slide, please. Our recommendation is for Outdoorsville to leverage the systems, applications, and processes that are already in place, programs that are already in flight, and extend those with an eye on the equitable and inclusive access for underserved citizens. We feel that this approach would be the most effective from a cost and time-saving perspective, especially since the alternative would be to buy or build new solutions, which would be prohibitive. Next slide, please. As I mentioned, there's already quite a bit of infrastructure already in place. This diagram is meant to illustrate our understanding of the current systems and solutions and the myriad of stakeholders with an interest in accessing it. Enhancements or modifications would be needed to enable this open framework for citizens and other stakeholders to access their information. And while this looks a little bit complicated, the solutions for citizens are meant to be as frictionless as possible. So what does that really look like? Next slide, please. Today, the majority of citizens have smartphones, approximately 85%, as per a Pew Research study fielded earlier this year. Thus, we believe that most of Outdoorsville's citizens would be able to access their personal vaccine status via the already available My Outdoorsville app. But what does that mean for the remaining 15%? This is where we propose using a citizen's ID with the scannable barcode on the back. And they can either use their current state ID, which does have this barcode, or the real IDs that are being advocated by the Department of Homeland Security. As the state may know and may have already experienced, this is a program that DHS is really pushing the adoption of consistently across the country. Again, we envision that the state would be able to leverage an existing government app, a version of which is already being used by state troopers today, and extend the access to that app to businesses, especially venues. The state would obviously need to approve access to the app and perhaps tie that to business license or use some other method so that they can verify that access to the app and the system supporting it is used for the appropriate purposes. With this layered on a component, we believe that you might be able to cover about 97% of your citizens. What do we do about the final 3% though? You still have people who would potentially be uncovered. So here's where it gets a little bit less optimal, less technological. You're really looking at an analog solution here where you're either looking at the paper CDC cards that are given out when you receive your vaccine, or what happens if they lose those cards? Well, the stopgap for that would be a website where people could access their information and print out that scannable QR code. That QR code, again, would be scannable by the government version of the app that's already being used today, but with extended to businesses who would be approved for access. Next slide, please. Pulling it all together, though, obviously, it still has to be knit together with an open API. And so that's what would basically pull all of it together and make it possible for the solutions described on the previous slide to exist. Next slide, please. However, we can do all the work in the world to build those connections across systems and processes, but it won't actually work unless we have robust outreach to the general public, unless we engage key leaders at the state and county levels, and then finally work with community partners who can create awareness and adoption specifically with those underserved citizens without easy access to technology. You can learn more about these plans. Please take a look at the website. All of these materials have been made available online. So finally, we've covered quite a bit of ground in the last couple minutes. So just to summarize, this solution really is meant to be a template not only for the current COVID situation, but also for future instances where access to vaccine information might be necessary. So don't buy or build, instead enable and extend. Leverage those current programs, systems, applications, and processes that are already in place. You will need to layer in and establish an open and secure framework with API access to all the data repositories, and then augment all of that with a robust outreach and advocacy program to make sure that we're getting to those underserved communities. Thank you so much for the time. With that, I will turn it over to Enrique to show you a demo.
Thank you, Cecilia. Let me get my demo ready up here. All right, good afternoon, everybody. So I want to highlight a very brief version of our demonstration to show you and highlight one of the areas which we've talked about. So as you see here in the bottom left corner, that little orange icon is the app icon for the My Outdoorsville application. And just be mindful that we made some assumptions here how the workflow will work. The app already exists. We're just adding a functionality or feature into that. So with any phone or mobile app, you will log into the app. You're going to go through the actual authentication flow. You can log in, answer your credentials, and then we're going to get us here to this page here. This exists already. The My Outdoorsville application already exists, but I want to highlight the My Vaccine Record function here. So here, to highlight what we're talking about is we have the function for the citizen to add current, past, future vaccines here. If you see on the right-hand column, there's a privacy toggle there, which you can actually show to any kind of institution which you want to share. I'll demonstrate that in a moment. But this vaccine record page is to highlight the current, expiring, or due vaccines records which you want to share as a citizen. You can actually go in and add your COVID-19 vaccine, tetanus, measles, influenza, whatever you want to have. It's on the end user or the citizen to do so. But if you click in here to one of the actual vaccine records, COVID-19, you can demonstrate the actual provider, the date of the vaccination, the location, the vendor, the market, et cetera, et cetera. You can share with someone as well on the fly with that big green check mark. And as I mentioned earlier, the My Digital Vaccine kind of QR code. This is a scannable, verifiable resource for you to share with whatever institution you're working with. So as I highlighted before, if you want to turn that on, turn that off, that's actually what's added to this record here. Additionally, there's some other features which we highlighted to intensify the platform to add some news headlines as your profile features here as well. But we're not gonna get into the details of that for now. We want to focus on the vaccine records. And so with that, that concludes our demonstration. I want to thank you for your time today. And back to you.
Great. Thank you so much, Cecilia, Enrique, and to the rest of your team members for your demo and for your innovative and implementable idea of creating an open API system. I especially appreciate this idea because you all had thought about equity and providing an option for those who might not have access to state-issued IDs. So thank you for that. Next, I'm excited to introduce our third and last team for the afternoon. This last team includes Anjali Joshi, an engineering and product leader with a long track record of scaling new technologies and advising startups. Phil Marshall, a physician entrepreneur reimagining personalized healthcare through tech at Conversa. Ratna Saripalli, a health tech leader improving clinical outcomes with AI and machine learning as the global director of data science at GE Healthcare. Jeremy Tobin, a product leader and entrepreneur working at the intersection of tech and media at Warner Media. And Nevin Zimmerman, a longtime tech and business executive who is the CEO and founder of Uber Tech. For this presentation, we'll have Phil Marshall and Jeremy Tobin presenting. Over to you, Phil and Jeremy.
All right, thank you, Mai. It's a pleasure to be talking with you today. Let me go ahead and share my screen. As Mai said, I'm a physician myself, and so this was an exciting challenge to tackle. And so we characterized the challenge this way, and that is that if the state of Outdoorsville would like to minimize the incidence of COVID-19 in their population and keep the communities safe and increase confidence among the population to get back to work, school, and attend gatherings, events. And now that mask requirements have changed for vaccinated individuals, is a verifiable vaccine credential solution going to help them to achieve that objective? And if so, what is it and how can it be implemented? And if not, then why not? And what should be done instead? And so that is how we have recast slightly the challenge. And so just up front, we'll go through a little bit of background information and key learnings. Hopefully it won't be too repetitive. But of course, we started with what is it? What is a vaccine credential? The credential or passport is a way to provide proof of COVID vaccination status, and it can either be non-verifiable, such as the CDC card, or it can be verifiable, such as what a QR code might be able to afford. It might be used by event organizers, businesses, schools, or others to make sure of the individual's vaccination status. Now, a couple of other key learnings that we in our team have had. It's obviously become controversial, and 9 states have already prohibited the vaccine credentials, while 2 states have already embraced them. Unfortunately, the federal government will not be providing a vaccine credential, as states and vaccine providers are the ones with the data to provide such credential. And frankly, which was an interesting learning, some states don't even store enough information to provide them if they want to. We don't believe that you are in that situation. So several countries are developing these for travel, and technical standards are emerging for being able to do this privately and securely, such as the work done by the Vaccine Credential Initiative. And so the CDC card, to start there, that is a form of a credential. Of course, it's easily spoofable, even though it's quite easy to use. And on top of that, if Outdoorsville were to provide a state-sponsored online portal to allow access to one's own vaccine history, the advantages would be that that's right in line with HIPAA's position that citizens have rights to their own health data. But of course, that in and of itself is not verifiable either. And so as we go one step further, I'm going to turn it over to my colleague, Jeremy.
Thank you, Phil. So we want to establish that these are the 4 what we call pillars of having a verifiable vaccine credential. And when I go through each 4, let's be clear. A signed credential means it's the digital equivalent of a signature page. It's digitally been tracked at all times. So in other words, we consider it a prerequisite that whatever the proposed system we make can securely confirm a given individual's vaccination status. Point 2, we assert that the opportunity per se for a vaccine credential system exists somewhere between a minimum state where everybody could get a vaccine and sort of an end state where herd immunity or some other equivalent has made it irrelevant to even have a vaccination status to show to anyone. The third point, our concern here is that how might different groups and communities be adversely impacted by such a system? And what are the unintended consequences which tend to emerge through a lot of technology solutions? Additionally, we do recognize that the impact could be quite significant for non-residents, college students, people who work in the transportation industry, such as truck drivers and pilots, as well as business and leisure travelers. And finally, point 4, from our research, we believe the greatest opportunity to implement the system is voluntary by opt-in based organizations, because the implications for enforcement and policing such a system would be non-trivial to say the least. So let's move on into our solution. Next slide, please. Okay, great. Putting all the above in play, we've taken a slightly different approach to our recommendation. We're presenting this as a multi-step decision-making process rather than one specific outcome. So, considering the rapidly changing landscape we're discussing, we think that having it as a process is a better solution for the state of Outdoorsville than a fixed solution. Many of us in the technology industry would call this an agile style solution. So the 3 steps we look at are the necessity and feasibility of a solution, and if passed, how we might implement it. So let's dive into that in more details. Next slide, please. Thank you. In order to best serve the residents of Outdoorsville, we're going to consider the following. 1, can everyone who wants one get the vaccine? If we cannot offer it to those in need, we cannot mandate its use in any way. 2, is there a sufficient market demand? If this were a product, are enough people out there to buy it? Are business owners and organizations asking the state to do this? 3, do we think of this as low-hanging fruit or a huge uphill battle? We might argue if this were a Facebook relationship status, the answer is it's complicated. And 4, and one of our most important considerations, do we truly provide a tangible benefit by creating and offering such a system? So far, our recommendation to the state of Outdoorsville is that all 4 of these criteria must be met. And from our team's research, we do not believe they have yet been met. But just to continue down the path, let's see what we would do in step 2 once we have reached that status. So technical feasibility, can we do it? In short, from our findings, the current answer is no. The state's immunization information system does not currently provide access for all the state's residents to create or access accounts. So if you think of an analogy like the DMV couldn't exist online by offering, say, renewal license or registration without a basic web experience, user registration, recover passwords, etc., a similar underlying secure system must be built for vaccine credential retrieval. It is worth noting, we do not believe that building such an infrastructure is a highly complicated task in the modern tech landscape, but we do consider it a minimum requirement for implementing such a system. I'm going to hand it back over now to Phil to talk through how our recommendations go from here.
Yeah, so taking the decision tree one step further then, if those and when those first 2 steps would be true, then step 3 would be viable. And that is to prepare for offering a verifiable credential. And so we believe that there are certain basic standards that must be met. A person must have their own agency to opt into participation, minimize the data that's displayed on the credential, prevent any third parties from storing any unnecessary data, and the data in the vaccine credential should be used for proving vaccine status, and that's all. And so as we take that then one step further and look at a few features, opt-in, we've already mentioned, which also means the ability for a person to opt out at any time, and then the ability to download that credential, such as what you might find in a QR code that could then work to independently verify that person's status, which could be stored as an image, it could be printable at home, it might be an app. There's a number of ways to do that. And this is an example of that. And so a QR code could be generated for the vaccine credential off of the state system after meeting the prior requirements that Jeremy mentioned, and wouldn't have to involve passing identifiable information to any third party. And so it would connect in with real time into the registry. The advantages are that it would be independently verifiable, that verifiable credential, and signed by the registry. Disadvantages are that whoever is scanning it would need to be connected. And we put a little mock-up there for you for Outdoorsville. And so with that, hopefully that provides you some food for thought. We're greatly appreciative for being able to work on this project with you. And so I will turn it back over to Mai.
Thanks so much to Phil, Jeremy, and the rest of this third team for your creative idea of asking states to pass a series of tests before implementing a digital credential. I especially appreciate, as Jeremy said, the agileness of this solution as well. So next, I'm thrilled to announce the keynote speaker for our event, Cyd Harrell. Cyd is a longtime civic technologist and user researcher who has spent her career helping governments make technology work better for their constituents and staff. She was previously Chief of Staff of 18F, the US government's digital services agency. She is also author of a Civic Technologist Practice Guide, an onboarding guide and survival manual for civic technologists. Cyd, thank you so much for being here with us today and sharing your thoughts on these projects and on more generally the importance of bringing diverse tech perspectives into critical decisions like these. Over to you, Cyd.
Thank you so much, Mai. I'm honored to be here and to be able to hear all of these excellent ideas. To the teams, thank you and congratulations. I'm very impressed with how you engaged with what may be the hottest government tech issue since healthcare.gov, and one in which there are just an absolute myriad of considerations to think about. A couple of things I pulled in particular from your presentation. Tony's idea that you can't require people to have an iPhone to buy groceries. And I appreciated that the first team really engaged with this from a standards perspective and an idea that we want a unified environment across the country. Team 2 in particular had for me a design approach, and I also an API design approach in addition to a digital design approach. The use of the existing app that Outdoorsville had, I'm curious about the uptake numbers on that, but it sounded like there's already a majority. And I was very curious to see in the final prototype the potential expansions to things like flu shots. That meshes very well into what Team 3 did about a decision tree, because it's an interesting question whether we would put the burden of vaccine verification on people for a less deadly and more common disease like the flu. And finally, Team 3, which I felt engaged very much from a product management perspective, and I really appreciate your clear and lucid definition of non-verifiable versus verifiable for your client, as well as the potential utility of this credential in the space where everyone has access and we haven't yet reached herd immunity. So I wanted to kind of recap for the larger group where we are this week. As a couple of the teams noted, things are shifting incredibly quickly. So just this week, near my home, Chase Center, the NBA arena, has started a vaccinated seating section. And they're asking people to show their CDC card, which is the non-verifiable credential. That's interesting for a couple of reasons. Doesn't sound like a giant equity issue in that it's not an essential service to attend an NBA game. But it does already bring up some questions for people here. Can I bring my kid who isn't eligible yet for vaccination? And is this appropriate for other types of environments? We've had a lot of grocery stores in response to the recent CDC announcement saying they're dropping mask mandates. And we don't yet have a vaccine verification. And so what does that mean as far as who should be in a grocery store and how safe people should feel in a grocery store? And would having a verifiable credential increase that? The 85% smartphone availability in Outdoorsville is high, and that seems great. I wanted to call out in particular, partly because my teenager would be very upset with me if I didn't, that kids are part of the world of who is going to need to show their vaccine credentials in our situation here. Smartphone use for US kids may be higher in Outdoorsville, but it's around 70% at age 12. Best data I could find. And use of state IDs, I believe, is probably lower than that in many cases. 70-year-olds also have lower smartphone use. So I'm kind of envisioning the scenario if we had really high requirements for these, we might need a vaccine credential to enter a restaurant. That doesn't just mean a sit-down restaurant. That, as a matter of policy, will usually mean the local fast food joint or the local coffee shop. So, you know, grandma and the middle schooler head out for an after-school cup of boba or cookie. What do they need to do? And is that reasonable to ask of them to be able to participate in that aspect of public life? So one of the things I'll say to the leaders newly considering entering public sector, and with so much of my thanks, is that having done it for a while, those of us who join government agencies or otherwise participate in this sector often get permission to ask awkward questions. And one of my favorites from the product management world is really, why are we doing this? And how are we going to know that it's working or not working? I think, and several of you came pretty close to stating it, especially in the second last slide from Team 3, if doing whatever the vaccine credential is doesn't increase public safety, then Outdoorsville shouldn't do it. And figuring out how to answer the question of, does it increase public safety, or in what circumstances would it increase public safety, is something I would love to see leaders working with their partners and clients on, from those rigorous product management perspectives and some of the other ones that you bring in. I started adding to this sentence to say, well, okay, if it doesn't increase public safety equitably, as so many folks mentioned, we have, equity of access, not just to smartphones, but to printers, equity of access to data plans. There's also the question of who tends to get asked for their credentials more than other people in these lovely United States. Does this actually increase public safety over and above a less burdensome program like the CDC cards? And I thought, showing the CDC cards, they are fakeable, but it takes a bit of work. They are potentially being sold, and that sounds like a real problem. But I don't know. And I think if I were in a state government, I would want to ask my epidemiological staff to help me figure out what's the impact if some credentials are faked? And what's the impact depending on where we are in the process of achieving low community spread and vaccine uptake within the population? If 1% of cards are fake, how much does that actually decrease the public safety in, say, a grocery store? What about at a parade? What about at a stadium? And then we have the idea that at a cost that is worth the amount of increase that we buy to public safety. And again, that is more than just a sort of safety theater where people who can easily access a verifiable credential feel safer, while our safety is not accruing as much, maybe to more vulnerable populations who don't have as much access to whatever technical mechanism we're using to display and create credentials. The time period when it matters. I appreciated so much what Jeremy said about there's a space between everyone having access and us reaching herd immunity where that makes sense. And my mind actually went right back to the age situation there, where right now, just about everyone over 12 theoretically has access, although that may not be as true in a practical sense. And we're looking at, hopefully by fall, we may see elementary school kids having access. And I think it's actually going to be quite an interesting question for policymakers, how to include youth and children in these calculations of who needs to have access in order for it to be ethical for this to exist. Children also being less likely to have smartphones, being worse at carrying around pieces of paper, are interesting to design something like this for if it's something that needs to be shown frequently. You might think that much like with a passport and a very young child, you can add a kid to a vaccine credential, but kids over about 9 or 10 circulate around in the world and take public transportation, another activity, which is a really interesting question for whether you would restrict it to vaccinated people. So I think that considering them is one of those interesting cases of designing for a difficult case and helping figure out what we should do. But I think very rightly, the decision tree built by Team 3 and the Team 1's memo to the feds, asking the feds to set some of these standards for whether Outdoorsville should do it. Getting a little deeper on questions. How do we figure out if this increases public safety enough? What settings would we need to use it in for it to meaningfully change safety? Is it every time we enter a building or get on a bus? Is it only really those kinds of situations like the start of a school year or the beginning of a new job or going to an airport that are already marked, and where we would now already present some kinds of credentials where it wouldn't be that much of an extra burden. I also really agreed with Team 2's eventual integration of this credential with state IDs. Those have their own access issues, but if this is something that we need over a space of multiple years or decades, it probably should somehow be integrated into existing ID systems rather than being a fully separate item. Everybody talked about this being voluntary and opt-in, and I'm really curious how many people would need to sign on for it in order for it to really be effective in increasing our public health, safety, and security. And a piece of that question is, again, how much does the fraud matter? There's been some interesting explorations of New York's Excelsior Pass, which is this blockchain-based one that it is actually fakeable if you are savvy. But the question of how many people would try how hard to fake it is one that I don't have a good answer to, but I think it's one that requires at least an estimated answer from the kinds of social scientists who work on perhaps voting fraud and things like that in order to shore up a key piece of the data in the decision system. And absolutely the question of when could this be sunsetted? I think this is an important question for almost any tech intervention in government, but I don't think, and I didn't hear anybody recommend certainly, and I wouldn't recommend to Outdoorsville, the idea of setting up a sort of perpetual expectation that we share immunity data multiple times a day in order to participate in public life. That doesn't sound easily like something I want to say we should commit to. And so we should think about, how do we stop ourselves from doing that? How do we stop ourselves from, what happened after 9/11 when we started displaying American flags and there wasn't a set end to the period of warning. And so we saw people's flags get tattered and sort of stay out there. How do we have those conditions already in place where we stop using the system when we're ready to be done with it? And so all of these ideas that I think all three teams have outlined will be necessary for the fictional state of Outdoorsville in deciding what the best thing is to do on behalf of its residents and constituents. But I think the teams have done an enormous amount to illuminate what Outdoorsville should look at and how difficult this question is for every state government in understanding how best to invest its tax money, its staff time, and its burden on citizens in increasing public safety with a novel disease like this. So thank you again to the teams, and thank you to Telly and Aspen, and thank you to all of you for being here.
Thank you so much, Cyd, for those words and for responding to our team's projects. I especially appreciated how much you connected these projects to things that are happening in real time. This project was especially challenging as you mentioned, states and private institutions were changing their guidance on a daily basis while our leaders were working on this. So I really appreciated that tie into what the CDC's announcement just last week. Next, to all of our attendees, we're going to spend a few minutes on Q&A. So just a reminder that you can enter some questions in the Q&A box below. And I will have my first question be for Cyd while I have you here. So in some ways, this conversation about vaccine credentials and digital vaccine credentials intersects far more with ethics, politics, people's perception of privacy than necessarily it does with technology. Why do you think it's important for technologists to be part of these somewhat political conversations?
That's a great question. I think it's important to engage with them with humility, but technologists also bring a number of disciplines that engage with similar questions in very concrete ways, from the development of tech products that engage with, impact on users, impact to wider communities. And I think that we bring this particular skill in identifying those kinds of impacts and translating those into concrete actions. We also often carry into the government space a certain kind of privilege because everybody thinks technologists are really smart. I don't personally claim that, but what we can do with that sometimes is put forward things that can be hard for other people in the space to say. I have never worked on a government technology project that was mostly about the technology. So this ends up being one of the most important places to engage.
Wonderful. Thank you so much, Cyd. My next question is for the first team, Elizabeth and Tony. So we've had a couple of comments in the Q&A box talking about how vaccine credentials at a state level are difficult to implement because people travel in and out of states. And yours was the only solution that really talked about a federal solution. So I'm curious, why not ask the federal government to actually develop this type of credential rather than advocating for them to establish a set of standards?
Sure. So we actually talked offline about this very question. And honestly, our first proposal was that the federal government should do this. We then got signal from the federal government that they were not going to do this. And so we changed course. We also, and I think it's in the answer, and Tony may be able to speak to it better, we have, there's a more technical reason as well that another team member provided. I don't know, Tony, if you have any additional thoughts on that.
Sure. Our colleague Ladna had also done some thinking about this. She wasn't able to stick around for the rest of the session, but as she put in the chat, some of the feedback that we received when we were looking at this at the federal government level was, I guess, some just broader concerns around holding the health-related personal data of citizens at the federal level. Something that really just hasn't happened before, and so there might be just some broader policy implications associated with developing that. So, from our group's perspective, yes, there was certainly a benefit to adopting a uniform standard and managing it centrally, but to the extent that there wasn't really an appetite to take on a problem that large, then I think the next best solution, we thought that the next best solution was to encourage the release of a standard that jurisdictions could iterate on and use the baseline. If they wanted to innovate on top of that, they could, as long as these baseline standards of interoperability and the like were met. And perhaps it's no different from what you see with different states having various versions of Easy Pass that allow for interoperability. You can still drive up and down the turnpike, even though each state has their own system and keeps data separately.
Great, thanks so much, Elizabeth and Tony and Team 1. A question for Team 2 for Cecilia and Enrique. Why did you decide to connect this vaccine credential system to the state database of driver's licenses? Are you concerned about the privacy implications of this design choice?
So thank you for the question. I think what we looked at was, ideally what you want to do is be able to leverage the systems and technology that are already in place and leverage those connections. The idea was that you're only accessing the components to verify that the person who is in front of you, that this is actually them and that is their actual vaccine status, but that the ability to actually see anything more than that would be limited. And that is something that the state, and I would assume in consultation with all the various stakeholders, would decide how much or how little to show, and that citizens would have quite a voice in that. Does that answer the question? Enrique, do you have anything else you'd like to add?
No, that was pretty spot on. So.
Great, thanks so much, Team 2. For Team 3, for Jeremy and Phil, have you considered methodologies that serve the unvaccinated in your solution? So could there be consideration for the inclusion of unvaccinated individuals who carry a certain level of immunity or antibodies if they're tested?
You want to do this one? You want me to go, Phil?
Why don't you start? Go ahead.
Sure. So if you think about our approach by being a decision tree, and one of our sections there was having the needs of all of the residents as well as potentially visitors or passers through being met, we would probably argue that that would be part of that decision process, such that when it comes time to issuing, that has been accounted for. So whether that's some kind of bypass step or antibodies identification, I think for us, it's less prescriptive that this is exactly how it gets doled out as opposed to how it gets authorized at all.
Great. Thanks so much, Team 3. And this is a question that I have for all of the teams and for Cyd, so we'll give each team a chance to respond. So if you have one key takeaway for state governments that are grappling with this question, what would it be? So we'll start with Team 3 and then go backward to Team 1 and then to Cyd.
Jeremy, do you want to give a go at that?
I think, and it was what Cyd referenced, and I think even my reference in our presentation, I think we fundamentally believe that the more governments at the state, federal, any level can approach things with agility, be reconsidering the situation as it's changing, right? In 6 months, we'll be having this discussion and talking more about variants and boosters and other issues. So I think my strongest recommendation is don't decide now what's going to happen next year. Look at what you need to do now for today and for tomorrow, and then have the next step ready to go when that hits.
Great. Thanks, Jeremy.
Thank you.
Team 2?
I think if it was one key takeaway, we really wanted to acknowledge and honor the amount of work and infrastructure that already was in existence for the state, and not propose solutions that didn't already take advantage of it, and honor that. And really, I mean, I think if the word for me was always amplify. How do we amplify what's already happening and expand upon that and leverage that, as opposed to reinventing the wheel? And so I think our solution certainly speaks to that. And I think the other team's solutions also do as well.
Great. Thanks, Team 2. Team 1?
Yes. So I would just say, I think that after all of this, I still think that advocating for a set of standards is the way to go. And that is because we've come this far without a passport. Look where we are with reopening. And I think the focus now needs to instead be on addressing vaccine hesitancy.
Great. Thanks, Team 1. And Cyd?
I think, always the question of, would something simpler work just as well? And finally, the really big one is, how would we know it was working? And those are questions that will rarely guide you wrong, even though not sharing an answer with you right now.
Great. Thanks so much, Cyd. And thanks so much to all the teams. As we close this afternoon, I wanted to thank everyone for the teams and the speakers for their outstanding work on these projects. As I mentioned before, the fact that they were able to produce these ideas during a part-time program in just a few weeks when things were changing daily really gives us a glimpse into what's possible when you partner civil service leaders with modern technical experts to improve public policy. Before we close the afternoon, I also want to take a moment to thank everyone who made this specific event possible. This includes our amazing tele staff, Meha Alawalia, our director at the Hub, Betsy Cooper, Cass Madison, and along with anyone who mentored and supported the teams as they conducted research on their projects. I'd also like to thank the Keynote, Cyd Harrell, and of course the tele leaders themselves for all the work you all have done. We hope you all will join us next week for the last and final of our tele demonstration days, where we'll be releasing 3 more projects from our tele program. The event will be on Tuesday, May 25th at 4 p.m. Pacific time, 7 p.m. Eastern. We'll be releasing 3 projects focused on helping city governments think through how tech can be used to expedite COVID-19 relief opportunities for small businesses who've struggled quite a bit during the pandemic. The event will be keynoted by Tarlyn Gray, Director of the Office of the Small Business Advocate for the State of California. We've pasted the registration link for that webinar in the chat and hope you'll join us for that session. Thanks again for joining us this afternoon.